12:05 in the afternoon here on 90.3 FM. Helping Seniors of Brevard is ready to get going. I'm John Harper, and of course our host for Helping Seniors of Brevard and the Executive Director, Kerry Fink. And Kerry, good to see an old friend of ours here in the studio, Dr. Dave Weldon.
Great show lined up for today. First of all, welcome. It's our Wednesday lunch gathering, 12 noon to 1 p.m. We do this every Wednesday right here on 90.3 FM, WEJF. And thank you if you're listening online at WEJF.net. And also for those of you who catch this as a podcast, as we go down the road, you'll find Helping Seniors Radio every place you find podcasts, every place from Apple iTunes to Hey Alexa, play me Helping Seniors, to Spotify, iHeartRadio. Helping Seniors is there. And we're the nonprofit that Joe Steckler, who got the Brevard Alzheimer's rolling all those years ago, and they call them Joe's Clubs to these days. He's the guy who got Helping Seniors going because there was more work, he said, Kerry, to do for seniors, because every senior, not all seniors are challenged cognition-wise, but every senior runs into stuff that we have to do. And that's why I thought today's show should be so much fun. We titled today's show, Looking Out for Our Seniors. And let me introduce our esteemed panel of guests. Let's start with some friends of ours who are right there every day with us in the Helping Seniors. We call it Joe's Senior Resource Center. It's that lovely location right there, 1344 South Apollo Boulevard, that the Omni Healthcare Group made available so that we could kind of fulfill one of the things that Joe had always talked about from day one, which is having a network center, a resource center, because the mission of Helping Seniors as a nonprofit is to inform, educate, and connect seniors to resources. And so to that end, let me first introduce somebody who actually serves on the board of directors with Helping Seniors, but she has her own company too, called Emerald Care Management, Karen Wernlund. Welcome to the radio, Karen.
Thank you so much. It's a pleasure to be here in great company.
Yeah, absolutely. And also one of the residents at the center, too. We were just talking, you've been doing this now for 16 years in our community. Danica Scuderi-Carluccio with Advocates for the Aging. How are you today?
I'm wonderful. Thank you for having me.
Yeah, you know, and this is an outgrowth of a panel that we did, because we do a fourth Thursday education series in the mornings there, and we always have like 25, 30 folks come out and show up. You're welcome to join us, by the way. Fourth Thursday morning, we do a thing called the Helping Seniors Wellness Series, and you guys were sharing a lot about case and care management, and it was a wonderful panel discussion, and we thought it would be a great opportunity for us to do that on the radio as well. So welcome, guys.
Thank you.
Thank you.
And also in the studio, as John Harper alluded to, somebody that I've had the pleasure of knowing for many years. He's always been a friend for many of the things that we've done together on ministry, but he's a medical doctor, a board-certified internist. He also served our country for 14 years, 7 terms. Am I saying that right, Dr. Dave Weldon?
Yes, you are. 14 years in the U.S. House.
And you're also a Army veteran, so thank you for your service as well.
Yes, and I take care of a lot of seniors.
Yeah, and we were having this conversation not so long ago. We were just talking anecdotally about a lot of the challenge that seniors face. Last year we took 5,450 calls on the Senior Information helpline. And Karen, you get a lot of those calls because you and your team of volunteers are really kind of like the front lines of that. And as you know, we get calls about everything: legal, medical, financial, transportation. But the one thing that has kind of risen to the top of the list lately has been the housing challenge.
Absolutely. The housing challenge here in Brevard County is really non-existent. Most of the subsidized housing in our area has a 1 to 3 year waiting list, if even they have a list to begin with. So it's very difficult to have to be able to share with those people that call into Helping Seniors of Brevard that it's just a tough situation. And sometimes if they have a decent place to live, but they just need to make some changes in their lifestyle a little bit, maybe they're with the son, sometimes it's our job to let them know that it's actually not as bad as you think where you are.
You know, that's an interesting point. We've been doing a program with the help of the city of Palm Bay. They've given us a small grant through the CDBG program and we call it the 55 plus Renters of Palm Bay Workshop. And there's an attorney, Frank Scaglione, as you know, Karen, because you've actually been to the workshop. I think we all learned a lot from him about this. But it's part of a thing called the Florida Eviction Prevention Project, and it's trying to educate seniors in particular, like, know what your rights are. So if your landlord is saying, I'm going to change your rent, or whatever they're telling you, at least you are prepared with what the facts are, what you can do and what you can't do. And that's part of it. But I've also seen you, Karen, in particular, as you work we have a big book, we call it the resource book. So when people are calling in, you and your team are able to go through there and try to find, okay, this person is calling about this kind of thing, and we kind of network you over to something that's going to be helpful there. And you've built a pretty good resource book about for example, the housing things, but the challenge is there's just not a lot of great options because the just what rents are these days in our county are really a challenge for seniors, given the fact that they've increased and the income for seniors just typically doesn't, So I wanted us to not really stop down on the topic. That's not our topic for today. We really want to talk about overall, how can we improve things for seniors on kind of a macro level and a micro level? And when I was talking with Dr. Dave Weldon just a couple of weeks ago, he was talking about, he sees it when patients come into his office. He sees seniors who are really fighting that fight every day too. So I have no idea. I'm not smart enough to know what the right answer for it is, but we always have this saying that they talk about it takes a child to raise, or it takes a village to raise a child. And we've really adopted that in our Helping Seniors world. It takes all of us who care about our seniors to try to find the right solutions. Dr. Dave, you've been practicing medicine in this county for so many years and have been a resource for so many. Have you seen that landscape change over the years?
Absolutely. What's really happened is Brevard used to be a low-cost housing area nationally, and it is now not a high-cost housing area, but it's a moderately high-cost housing area. And so rents are always a reflection of the values of the real estate, because we do have a free market in housing. And so the net effect is that a lot of seniors, I find, are facing challenges with affordable housing. I've had several have to move out of the area. They're no longer my patients. I had one couple move up to Titusville, and then they were able to find something reasonable they could afford back down in Palm Bay, and they moved back down, and they came back in my office after an absence of about a year and a half to establish with me as their doctor. And so housing is a big issue, but it's a plethora of issues. I really appreciate Helping Seniors and all they offer for the community, because I deal with it on a regular basis. Seniors that are failing, the typical scenario is the children live up in New York or New Jersey or someplace like that, and they get to a place where they're struggling, and the resources that are available can be very, very helpful in allowing people to stay in their homes and allowing people to remain in the community.
Yeah. I was thinking, Karen, as Dr. Dave Weldon was talking about that's really something that you hear all the time. And Danica, this is really kind of ties into what you do. I love it. You guys kind of like subtitled the program is life overwhelming? That's what a case and a care manager can do. And Danica, I want to ask you, because it's sort of the same question that I asked Dr. Dave Weldon, is you've been doing this now for well over a decade and a half. You said you guys are coming up in 16 years. You've seen the marketplace change, but I guess some of the basic needs just remain the same all the time.
They really do. The market has changed to the point where the seniors are not able to access the resources that are available because, such as Medicaid, they are struggling to get on the Medicaid program because there are so many seniors, not a lot of staff, so they're not able to transition to get that medical assistance or home assistance or transition into an assisted living. We've seen a lot of changes in their needs. We're in the baby boomers and their parents era now, where they all need assistance or some guidance to navigate our healthcare system.
You know, that was a point that I wanted to echo from that we said a few minutes ago, is that it seems like there's multiple generations getting involved in the senior world. I've heard some people talk about, you know, the sandwich generation, because on the one hand, you know, somebody who's in their 40s and 50s, they're busy raising their kids and busy with all those activities of life on the younger spectrum. But at the same time, all of a sudden, mom, dad, or aunt or uncle or somebody in the family is hitting a point where they really got to have some help. And these poor guys are like squished in the middle. They're trying to run for the younger and run for the older at the same time. And I was thinking, Karen Wernlund, you know, when you and your team are answering those phones, you get calls a lot of times from the senior themselves. Sometimes it's the spouse of a senior, but many times, just like Dr. Dave Weldon was saying, it could be the adult children of seniors. And interestingly enough, they could be out of town. They could be up north saying, hey, I was down visiting mom and dad, and it's not looking like they're handling it well. But even if they're in town, they're busy with their jobs and trying to keep everything else going and still trying to find a way through it, Karen.
So actually, that's where Danica and I come in. So we're different ends of the spectrum. Emerald Care Management, advocates for the aging, and we both are out there. You were talking about adult children that live in a different state. I think both of our businesses work very, very well with that, because wellness checks on any level, whether they be super simple, did they remember to plug in their phone, to super difficult, you know, do they have trouble taking their medications throughout the week? There's somebody in our business that can help them, and that can also reach out to the adult child and let them know, hey, your mom and dad's okay, or hey, I think it's time that we, you know, escalate to a different business. Maybe they need a little more help at home. Maybe it's even time to go into a memory care facility, a nursing home, an ALS. Just sharing with the children so that guilt can be a terrible thing.
Well, you know, it's not only that. It's like one thing, I guess, going through COVID taught us, too, was that even if you had good intentions and, you know, hey, I come down from, you know, New York State and I visit mom every month or so. But when COVID happened, nobody could move. And you guys really became the eyes, ears, hands, and arms. And you had to make it go, right, Danica?
We did. We had to be the boots on the ground, the eyes and ears for the family members, for the facilities, and most importantly for the client themselves, to make sure that their care was still up to par and they were receiving everything that they needed during that time. It did teach us as care and case managers that we need to be stronger advocates, stronger liaisons to keep the families in the now as to what's happening with their loved one and the care that they need and what is provided in Brevard County.
You know, I was going to ask this, you know, from a medical doctor's perspective, Dr. Dave Weldon, you know, we all lived through COVID. That put us through a real ringer of just trying to figure out different things. Has that changed in your mind? You know, what, as you see senior patients coming in, is it different? Is it, you know, how's it adjusted in that world?
Well, many people saw the suffering and some of the deaths, and so people are more vigilant. I get a lot more questions about the vaccines and which ones they should get. And I think there's a heightened awareness on the part of family members as well that their elderly parents, in particular, are vulnerable to not only struggle to make ends meet, but as well, you know, infectious diseases when they come around. So the other good thing, of course, is people are much more willing to put a mask on, which is good in many sense. Particularly if they're sick. Previously, you know, people would sometimes resist doing that, but if they come in the office and they're coughing and sneezing, we throw a mask on them, and that's very helpful.
You know, I am surprised how frequently recently, though, I've heard people say, I can't make something due to COVID. Like we had a guest speaker that was coming to our Golden Providers thing, and she calls at 6:45 that morning and says, we just tested positive for COVID, so I'm not going to come in and share that.
Yeah, we are having a little bit of a spike. I'm seeing many more cases. The the good news is the form. The virus has morphed. It has changed, and most of these viruses do that. And the current version of it is basically a bad cold. So the typical story is, I had a sore throat and a cough, fever, and so I ran the test, and it's positive, and I have COVID. Well, they don't have the COVID that caused Omicron. It's not the COVID that caused Delta. It's not the original COVID. It's a new form of it, and it just gives you a cold, which is what coronavirus always did. Historically, coronavirus accounted for 15% of cases of the common cold, but it was more likely to cause a chest cold, whereas rhinovirus and some of the other viruses will more often cause what people refer to as a sinus cold or a head cold. So corona has been around for years. The current version of corona is maybe slightly worse than the average cold, but it's not like it was 5 years ago.
Yeah, it seemed pretty scary. I'm sure we all have stories. I know of people that wound up on ventilators, and some made it back, and some didn't. It seemed really scary when it first was there. What just out of curiosity, what are you saying if a patient calls up and they say, "I just took a test, doc"?
Well, I usually offer them a drug called Paxlovid, which I believe works. It shortens the duration and lessens the severity of symptoms. It's very, very similar to Tamiflu, which we will often give to people with influenza. Tamiflu doesn't make your flu go away. It shortens the length and lessens the severity of symptoms, and Paxlovid does something very similar. It gets you over the hump quicker, makes you suffer less, but it's not a magic bullet. It doesn't make it go away. However, I've seen some very dramatic results. Some people, they feel better within hours of going on it. It can have some drug-drug interactions, so you have to be a little careful when you prescribe it. You have to look at what other medicines the patients are taking. And some people, if their symptoms are mild, they do the test and they get a positive test and they worry and they call me and I ask them, how bad are your symptoms? And if they say, well, I just have a runny nose and I had a little bit of a fever, you can just take Tylenol and Mucinex or Robitussin, just like an old-fashioned kind of cold, and you can get over the current form of COVID without needing prescription drugs.
Well, that's actually kind of reassuring to know for many people. So I wanted to kind of bring this back to, because you said something about drug interactions, and that perked me up. We had another topic that we covered, as you guys remember, recently in our Helping Seniors. Again, it's the fourth Thursday of each month. Right there, we hold it. We take over the lobby of the second floor there, and we have these wellness series. And not recently, or fairly recently, we had a lady who has a lifetime of experience as a pharmacist. She's a licensed pharmacist, and she volunteers with the Helping Seniors organization. Dr. Cressida Cornish came in and did a whole talk about polypharmacy and all how you have to manage that. And I was thinking, for you guys, I'm talking with Danica Scuderi-Carluccio of Advocates for Aging and Karen Wernlund with Emerald Care Management. This is one of the things you guys invest time in, is to try to make sure that things like that are going the right way, that if there's prescriptions, that you're making sure it's as safe, and you're trying to help them just make sure everything is safe for them. Talk about what you do for folks in care and case management.
So we have nurses on our team, we have med techs and pharmacy techs. So what they do is make sure that they communicate effectively to all the physicians or medical entities that are prescribing medications to make sure that they know the accurate medications the client is on. We also speak directly with our pharmacist and ask for a review. In addition, our nurses go in the home, fill the boxes, make sure the medications are being taken appropriately and effectively. And if we see any side effects, we do report those. And I think it's important that a care and a case manager know the baseline of a loved one that they're caring for, so that we can see if there is a minor or a major change to report that.
Yeah. Karen, I think that's one of the things you always have explained, that you're kind of like that first rung of service. You're more invested in getting people to and from doctor's appointments or helping them get things around the house organized. And there's a point where you may say, okay, we're going to call in, heavier duty help. But I guess even at that point, one of the things I understood from Dr. Cressida when she was talking about polypharmacy was a lot of times you go to your main doctor says, okay, I want you to go see, I'm just saying cardiologist, whatever. You go someplace else, and then that doctor gives you prescriptions. But then if you go to a different pharmacy and everybody isn't really tracking what you're doing, you could get yourself in trouble.
That's absolutely true. And one of the things I like to share with my clients is it's so very important to have a well-written list of your medications either in your purse or in your wallet. And then secondary with my clients, if they have to have more medications, then it's important for me to go to the pharmacy with them, because the older we get, the less we understand about what the pharmacist is sharing. And so I'm another set of ears, and I can listen to that pharmacist well enough to know you're not taking that until we talk to your doctor.
Yeah, no, that makes sense. So kind of to continue the conversation about care and case management, and like you said, what do you do when life is overwhelming you? Do you find that you guys are mostly talking to the seniors themselves, or like you're within that household, or do you find a lot of times you're talking to the adult kids? And how do you help them like craft a path towards not being quite so stressed out?
Interestingly enough, we are talking to the seniors themselves and their children equally. We're seeing a lot more people reach out and say, I need help. What we do is we discuss their needs, we help navigate and show them the right path to be on. Karen, do you feel?
I agree. It is sharing that, looking at their situation, I always like to sort of look at myself as a set of eyes, a set of educated eyes that can look at a client and go, oh my goodness, their hearing aids are falling out of their ears. So sharing with them that who is your ear doctor? When was the last time did you see them? So just getting them up to speed with their appointments, and then I also feel that it's about 50-50. I speak to an awful lot of adult children who they don't know where to turn. And one of the things as helping seniors at Brevard is a number of people who call, they don't really even know why they're calling. They know that we're a resource center. They just aren't sure what they need. And it's sort of up to us to, and Danica as well as she goes in, it's sort of up to us to help them navigate to what is going on in their life.
That's a good way to put it. That is Karen Wernlund with Emerald Care Management, Danica Scuderi-Carluccio with Advocates for the Aging, and Dr. Dave Weldon, board-certified internist and former congressman. We're going to continue the conversation in the second half of Helping Seniors right around the corner. Stay with us.
12:34 in the afternoon here on 90.3 FM. It's Helping Seniors of Brevard, heard every Wednesday, 12 noon to 1 o'clock. I'm John Harper. Let's get back to more of the program with your host and the executive director of Helping Seniors of Brevard, Kerry Fink. Kerry?
Hey, John Harper, thank you, and welcome back for the second half of Helping Seniors Radio. It's our Wednesday lunchtime gathering right here on 90.3 FM, WEJF. We were just talking during the break. You know, this is a big signal. It's 30,000 watts, and it covers the entire county, and actually the general manager was saying it actually goes down into Indian River as well. So it's a great signal for us, and we're really blessed to be on this station, but also blessed to be the fact that you can hear us online at WEJF.net. So a lot of people will tune in that way, and then we take everything we do, whether it's the radio programs, whether it's the television programs, or even when we publish in the center section of Senior Scene magazine, we put all that out on our website, which is helpingseniorsofbrevard.org. We put that out on our Facebook page, and we put it out on our YouTube channel so everybody can look at these programs, because what we found over the years, we're now moving into a decade, closing in on a decade and a half of service in our community. And one of the things that we've learned is sometimes the topics we talk about aren't relevant until somebody arrives there. Here's what I mean by that. Somebody all of a sudden will want to learn about guardianship. And, you know, it's now they had a situation come up. The family runs to an attorney and says, Mom or Dad is in the hospital. They can't sign papers, but we got to pay the mortgage. And you say, let's see the papers that you do that. They don't have them. Now it becomes a much bigger problem, as Danica Scuderi-Carluccio, one of our great guests, who serves as a care manager, case manager, and a professional guardian through Advocates for the Aging. Welcome back.
Thank you. It is important that families meet with their loved ones and really look at whether they are prepared for the future. We know that we have a road that we're going to go on in the journey. We don't always know the results. So we want to be prepared in choosing the people we want to take care of us, making those decisions, and those people that we designate really need to know what your desires are. We can't wait till it's a crisis situation and then put yourself as well as others in a corner where the only alternative is a guardianship. Guardianship was meant to protect people and be utilized as a last resort. There are so many resources out there that give us the opportunity to plan our estate planning and make the decisions and pick who we want to facilitate all of our changes as we grow older.
Yeah, but if you don't have the paperwork and the emergency arises, you can talk till you're blue in the face, but the court isn't going to accept that, and that's why it's so important. Joe Steckler, our president and founder, has always talked about from day one. He said, you got to make an aging plan. And I remember when I first was talking with him about it, that sounds like really complicated. I need to break out 3-ring binders and do like little charts and things like that. And then I finally got it. It's like a hurricane plan. It's not that you want a hurricane, it's that you want to have thought ahead about what you might do if the storm is coming at you. And Karen Wernlund, you've been with Emerald Care Management, but also serves on our Helping Seniors Board of Directors. You've been kind of on the front lines taking those calls from seniors, and you kind of get that deer in the headlights kind of look. You can tell it's happening over the phone a lot of times when they're calling in for help.
That's absolutely right, Kerry. One of the biggest things is that people don't understand what a legal document is to begin with. And so I've had a phone call. It almost broke my heart. This woman just wanted somebody to notarize a few changes that she was going to make in her will. And I was like, no, you can't have a notary do that. You're going to need a lawyer to go over what you're changing and then have it reissued under a lawyer's ship. But one thing I did want to talk about was I'm an advocate for guardianship, and I'll tell you why. There are so many people in our county, in our state, in our country that have no one. And that is where guardianship, if a neighbor reaches out to Advocates for the Aging, that's where guardianship is an angel. They can come in and make sure, through the courts, of course, that this person is not going to be taken advantage of. I see so many seniors taken advantage of simply because they're an easy target. So for me, guardianship is an excellent thing.
Yeah, we've certainly seen a lot of times that comes up. Dr. Dave Weldon, medical doctor, joining us, former congressman. Thank you for taking time to be with us today.
Yes, it's a pleasure to be here, and I want to comment on this concept of having an aging plan, because Joe Steckler, he was very good the way he used to advocate for that, because I see this maybe not on a daily basis, but I see it on a regular basis, and it's really rooted in denial. People will be living alone, or they will be living with a failing spouse, and the failing spouse dies, and there they are, and you talk to them about the fact that they're not going to get younger, they're not going to get stronger, they're not going to get smarter and quicker as the years continue to accumulate, and they need to have some sort of plan. And a lot of people, they operate in denial, like it's never going to happen to me, I'm never going to fail. The one thing I do want to add is some of the toughest cases are these people that have no family. Maybe they got married, they never had any children, all of their spouses and cousins or cousins and other family members pass away, and then their spouse passes away, and there they are, they're alone totally. And what's interesting to me is how often neighbors step up. And I can't tell you the number of times I've heard people say, because they often get to a place they can't drive. And how are you getting here? Oh, I have this great neighbor. And the other group is church friends. A lady from church takes me to all my appointments. And so, and that can be part of your aging plan. It can be, reach out to your neighbors, because sometimes your neighbor is retired also and looking for something to do. And they're happy to take you to your appointments because it gets them out of the house. And so people need an aging plan. They really do. And most of the time, of course, it falls to the children and other family members. But we're in Florida. And, when I was in Congress, I learned that the district here was the 6th highest for the number of seniors in a congressional district. 9 of the top 10 congressional districts in the United States for the percentage of seniors are in Florida. Okay, I think there's 1 in Arizona that is up there, and my district was the 6th nationally largest, and of course now I'm no longer in Congress. I'm practicing medicine, so I'm dealing with it on the ground, and organizations like yours, everybody represented here on this program, do a lot of good. They really do, and they're needed. And they need advocates in government helping them get the resources they need to take care of our seniors.
Yeah, I want to really applaud what you're saying because, we make this comment. Joe has always been like a leading voice advocating for seniors. And, the statistics in our county, 1 in 4 of us is over 65. And 1 in 2 of us is over 50. And that makes you a senior, at least in AARP's mind, because they're going to send you a card, whether you like it or not. But the real point is this, and we've talked about this, because Joe was really ahead of the time when he talked about senior issues, because he said, Kerry, I was, when I retired from the Navy, I began all this work like in the mid-'90s when he was trying to get the Brevard Alzheimer's thing going and get all that built up. So he's been invested for many years in seniors. And he would always say to me, he said, we don't take enough care of our seniors here in Brevard County, and there's going to be a growing need. And it really happens now 3 ways. First of all, the boomers are all turning 65. So all of a sudden we just have a huge more number of seniors than we did before. But number 2 is 20, 30 years ago when Joe was getting this started, people didn't live to 100. I don't know about you guys, but you can speak to this better than I do. But when I talk to people who are really hands-on in the industry, they say it's not unusual to have be helping somebody who's 95, 102. We had a lady who came by and gave a history lesson for us at the center. She was 100 and going on 101. And if Jennifer hadn't told us, talking about Jennifer Barton with Seniors Helping Seniors, if she hadn't told us this lady was 100, I never would have guessed. Would you guys?
Not at all. And we are seeing clients live longer, but also we are seeing younger clients as well in their 40s and 50s, which again circles back to being prepared. It doesn't matter how old or how young you are, you should always be prepared for that what if for your medical care. Right. And know who you want as designees and how you want to be treated. So I think all ages at this point, it's very important that everybody looks at what they want in their life plan and make sure that they have those documents appropriately drawn up.
And then the third thing that's really impacting why we're getting so many seniors, particularly here in Brevard County, is the fact that now everybody seems to want to move to Florida, which is great. I mean, it's funny. I was talking with Mark Gallegos, who's a realtor, and he and his wife arrived here from Miami like 5 years ago. To him, the housing market is pretty cheap compared to Miami. But for those of us who have been here a long time, we're like, wow, look at what's going on here. But the fact is so many people are moving to Florida, and these people may come maybe with documents that were okay from wherever they came from, Illinois or, someplace up north, but they are could be interpreted differently here. And so one of the things, if we're going to really create that safety net for seniors, we have to look at all those cases, new seniors the eldest seniors, and then the ones that are moving in that are really just trying to find their way into the community. Dr. Dave Weldon, you must see all three of those impacting your medical practice, as people are moving to Florida.
Well, the average life expectancy of, an American, when they created Social Security was 65, and that's part of the reason they chose the 65 number. At the time of the creation of the Medicare program, which was, I think, in 1966, average life expectancy was about 70. And, of course, now it's 80, and that's on average. 79 for women, 79 for men, 80 for women. When I first started practicing medicine 35 years ago here in Brevard, it was unusual to have, somebody come in my office who was in their mid-80s. Now I see many every day, many in their early 90s. And I have numerous patients who are in their late 90s. And I now have another one who's made it to 100, and he's actually going to be 101. What's interesting about a lot of these people, if you really look at them, many of them, but not all of them, but many of them have survived one or more life-threatening medical conditions. What I mean by that is they survived cancer, or they maybe had bypass surgery or something like that. So they should have been dead and buried 10, 15 years ago. But here they are. They had their cancer successfully treated, and now they're 92 years old. And wow. So and of course, the drugs. We were talking about drugs earlier. I spend a huge amount of my time as a physician trying to figure out if my patients are taking their medicines the way they're supposed to, which drugs were added by the specialists. Maybe they were in the hospital and got discharged from the hospital and they're on some new drugs, and some of the drugs I had them on were stopped. It's very, very confusing. But these drugs are keeping people alive. The early recognition and treatment of high blood pressure and elevated cholesterol is keeping a lot of people going. And that's a good thing. We want to live as long as we can. We want to be as healthy as we possibly be, as active as we possibly can. And these medications are helping. They really are. But the whole scene has changed so much more towards older people. Now, I do want to share with your listeners one other little tidbit, because you were bringing up the growth in Florida. One of the last hearings I went to when I was in Congress was put on by the Census Bureau. I was on the committee that funded the Census Bureau, and they were doing this report on projected growth rates for the next 40 to 50 years. Now, this was a hearing I went to 16 years ago. Wow. And the part I was most interested in were the projections for the state of Florida. And I got into quite a bit of Q&A with the Census Bureau experts. And they were projecting the population of the state of Florida was going to grow over the next 40 to 50 years by 10 million people, okay? 10 million people. That's like adding all of Ohio and a portion of Indiana. And it's not 10 million people carrying suitcases. It's schools, it's hospitals, it's roads, it's power plants, the whole enchilada. And we are ahead of schedule. At the current rate, we're not going to add 10 million. We're probably going to add 13 million or 14 wow. million people. And so this has huge implications for everything that you do with helping seniors and all of these associated groups. And now it also has a lot to do with roads and water and recreation and parks and schools. How do you add 10 million people to your state? It's really breathtaking, but that's what they're projecting.
I was having this conversation just the other week with, again, I mentioned Mark Gallegos, who's a realtor in this area, and he and his wife had relocated from Miami, and he was saying that we've now crossed 23 million population here in Florida. And I was thinking to your point, Dr. Weldon, is like, that's what is kind of amazing, that it doesn't show any signs of actually letting up. It just feels like we're going to have more people. And so back to my original point about this was when Joe founded, he said, I want to, devote the rest of my life. Joe is 90, and every day he's working somehow trying to make something happen to help us. Literally yesterday, he's like writing letters to all our pastors in the area say, you got to help us with our fundraiser, the car raffle. And so Joe, there's not a day goes by Joe isn't working for seniors. But all those years ago when he started on that, he was talking about that this need is only going to grow. And here's the statistics, I think, that I've kind of like really looked at, and I think there's room for us to step up and do better. So in our county, we love and care for our kids. We've raised a 50-cent sales tax because every time we go to the store, we're willing to pay an extra 50 cent of sales tax because we want our kids to have the best schools that they could possibly have. This is in addition to whatever they've apportioned in our property taxes and different things like that. We want our kids to have a great education. All for that. So the question is, we have more seniors over 65 than we do kids under 18. What do we do for our seniors? Are we doing enough? And judging from the calls, there is such a room for that. Particularly Dr. Dave Weldon, I wanted to ask you, because you have such a breadth of experience. You've looked at it nationally as our congressperson. You have looked at it locally because you're invested in the community. You're working with people. So it seems to me like there's things that we need to be focused on citywide. There's things that we need to be focused on countywide. Certainly whatever we can do nationally to impact, but also I would think statewide. What are the things that could make a difference?
Well, I would make a pitch for better funding for the Department of Family and Children's Services, because one of the sore points with me is I get in these situations sometimes where I have now gotten to a place where I am concerned about the safety of this person. They're living alone, their memory is failing, and maybe, you know, they're being exploited or something like that. And so I'm obligated to report that, and you get an operator in Tallahassee. And then I don't hear anything for weeks, and it's because the workers are stretched very, very thin, and frequently they do nothing because they do this assessment, and if you don't meet these thresholds, they just continue to monitor the situation, and maybe your other guests can add to this, but I've gotten to the place where I'm now very, very reluctant to call our state agency responsible for monitoring seniors because I know they're overwhelmed. They're just totally overwhelmed, and that speaks to me that we need at least more caseworkers. Now, these situations are very, very difficult because there's a huge number of legal issues associated with going into some seniors' house and forcing them into a nursing home or assisted living. And you have to get the courts engaged. So I know it's not a trivial issue, and I know the workers that are out there are doing their best and they're working hard, but I get the feeling that we don't have enough resources. And now I was going to ask you, are you going to get serious and propose a 50-cent sales tax for seniors in Brevard County? Because that would be a very interesting debate. You know, the kids, you know, always speaks to everybody's heart, you know, and we got to do whatever we can for the kids. I'd be interested to see that there would be a level of compassion for seniors that would be equivalent, but it's a problem. You know, we're just being overwhelmed. People are moving in here by the thousands, and many of them are arriving with limited resources. And a lot of times the existing infrastructure is overwhelmed as well. But helping seniors is a critical part of what we have in Brevard. And kudos to you and Joe, who started all of this, and all these advocacy groups that are stepping into the breach and trying to do what they can to meet the needs of our seniors.
Yeah, thank you, Dr. Dave. Well, you know, one of the things that was funny when you asked that question, you said, you know, would you guys consider a 50-cent sales tax? I'm not smart enough to know this, but, you know, Joe, being Joe, he wants to dig and he wants to find out. So he called the county commissioners and wanted to know. He said, it's got to be public information. How much money have we raised with that 1 50-cent sales tax over the past 3 years? And he got an answer. And I don't know if you guys know this number, but to me it was shocking. $161 million over the 3 years. Could you imagine? I mean, for the work you do, the work you do, the work you do, I don't know how you work with that kind of money, but could you imagine the difference it would make for seniors, particularly when we're talking about, we get calls from seniors who are trying to find a place to live. Their landlord took their rent from $800 to $1,400. They only get $900 in Social Security. They might as well have told them the rent increase was going to be $1 million because there's no way they could do it. But if we just had a little bit of resource, and then the other thing Joe talks about a lot, and at least in every investigation I've found, I can't find any evidence of this. We're pretty good about allocating federal dollars locally, like our governments get CDBG funding, and they will use those. Like we have a grant from the city of Palm Bay. I spoke about that before. We have help from Brevard County to help actually with our senior information helpline. But it's not county money and it's not city money. It is actually, they're just allocating what they get as an apportion from the federal government. So Joe, being Joe, he goes and digs into the county budget, over a $2 billion budget, and literally the line item for seniors is almost non-existent. It's less than 1/10 of 1% of the budget. Now, you ask anybody in government, and they say, well, yeah, but, seniors use the roads. They're paying for that. They use the libraries. They use the fire department. They use the police department. Well, so does everybody. But what can we do better to help the plight of seniors that are in these challenges? And sometimes it's money, but sometimes it's just knowing where to go and what to do, Whoever wants to grab that.
I do think education is a big component that needs to be discussed, because the DCF workers, Department of Children and Families, if they're educated on some of the resources out there, they may be able to assist. And yes, their funding is poorly given, but education goes a long way. And I do feel that they could make a difference, and so can a lot of people if they just know the resources out there.
Wow, that's a great place to kind of wrap, because that's what we exist to do. We're too small to do a whole lot else, but we try to get information to everybody that will make a difference, and sometimes it's just knowing who to call. So I want to stop with Danica Scuderi-Carluccio. If somebody wants to call Advocates for Aging about case, care management, guardianship, what's the best way they reach you?
They can contact us at 321-953-2273, and that is the best number.
And how about you, Karen Wernlund, who actually heads up the Helping Seniors info line, but also Emerald Care Management? How do people find out about getting help?
Emerald Care Management can be reached at 321-622-8030.
And Dr. Dave Weldon, final thought. We have about 10, 20 seconds. So.
Well, I just want to say thank you, Kerry, for having me on and raising public awareness of the plight of our seniors. Most of our seniors are doing fine, and they have resources. We're really talking about the neediest of the needy. And this is a rich country, and it's a rich area, and we should be able to care for those in need.
Well said. That's our whole reason to do this. Well, that's the time we have on today's episode of Helping Seniors Radio. Thank you guys for being in the studio with us. We will see you back here next Wednesday, 12 noon to 1 p.m. on 90.3 WEJF FM. Have a great week till then.